What is an FNA biopsy for thyroid cysts used for? Imagine feeling a lump in your neck and wondering what it could be. When doctors find a cyst or nodule in the thyroid gland, they often recommend a procedure called a fine needle aspiration biopsy. This test helps determine if the cyst is harmless or if it might be cancerous. The thyroid is a butterfly-shaped gland in the neck that produces hormones to control metabolism, energy, and growth. Sometimes, fluid-filled sacs called cysts form within the thyroid, especially as part of common thyroid nodular disease seen in adults. If a doctor notices a thyroid cyst during a physical exam or ultrasound, they might suggest an FNA biopsy if the cyst has certain features. These features include rapid growth, irregular borders, or causing symptoms like trouble swallowing or a feeling of pressure. The main goal of the biopsy is to collect cells from the cyst or nodule to analyze them in the lab. This helps distinguish between benign or non-cancerous cysts and those that could be malignant or cancerous. The procedure itself is minimally invasive and usually done in a doctor's office or clinic. Using a very thin needle, often guided by ultrasound imaging, the healthcare provider inserts it into the cyst. They then withdraw a small amount of fluid and cells. This sample is sent to a lab where a pathologist examines it under a microscope. Sometimes, additional molecular testing is done on the sample to look for genetic markers that could indicate a higher risk of cancer, especially if the initial results are unclear. Most thyroid cysts are benign, meaning they are not cancerous. An FNA biopsy can provide reassurance if the results show no signs of cancer. However, if the biopsy suggests cancer or if the results are inconclusive, further testing or treatment might be necessary. The procedure is generally safe, with only minor discomfort and rare complications like slight bleeding or infection. Understanding the role of FNA biopsy is important for anyone with a thyroid cyst or nodule. It is a key step in evaluating thyroid health, helping doctors decide whether to monitor the cyst, do more tests, or consider treatment options. While the procedure itself is straightforward, its results are crucial for guiding management decisions. That's why it's essential to have the results interpreted by a healthcare professional experienced in thyroid disorders. If you have a thyroid cyst, it's important to stay in close contact with your healthcare provider. Factors like the cyst's size, appearance, your symptoms, and your overall health will influence whether an FNA biopsy is recommended. This test is supported by major medical organizations and is part of standard thyroid care. Remember, it's not a replacement for ongoing medical supervision. Always discuss your concerns and questions with your doctor to ensure you receive personalized and appropriate care tailored to your specific situation.